Next up is ThermPix. ThermPix is modernizing thermal imaging for chiropractic practices. This is going to blow your mind. I was fortunate to come across ThermPix over a year ago. I saw it in action, and I continue to be blown away at how easy to use the tech is, how accurate the tech is, and how much it can really impact your practice. If you are ready to step into the future of clinical care, here's ThermPix. All right, everybody. I am here with Wayne Roberts from ThermPix. This is a company and a technology that came on my radar about a year ago. It really blew me away. I know there are chiropractors that are starting to learn about it, but at this Chiro AI Summit, we're going to dive in with Wayne specifically on what ThermPix does and how this can apply in your practice. So, Wayne, let's pick it up right there. Talk a little bit about what is ThermPix and what's the problem that you solve for many chiropractors out there.
Okay, ThermPix is the only FDA-cleared thermographic tablet on the market today. Okay, it's a Class 1 medical device. It's ISO 13485. But the most key factor in all of this is it is a Class 1 medical device. There are many thermal cameras out on the marketplace that you can buy off eBay or wherever, but they're not medical. And this gives you the medical grade photography that you would require to be a serious player when you're looking at diagnosing or pre-diagnosing certain conditions. Okay, so we provide, it's a unique device, and it is a unique device because a lot of devices out there will give you an image. This device gives you both the white light image of the patient next to their own invisible thermal image. Okay, so it will show the patient their invisible condition, and more importantly, it will show them their pain. They associate the moment they see the pain. Okay, that's really key and really important. It measures the temperature of blood. Blood does not lie. So as the blood comes to the surface under the skin, it will actually measure the temperature of the skin, or specifically the blood underneath, from an inflammation, from an infection, or from a particular restriction in the blood flow. That's what it does, and it's unique in the way that it will do that. Okay, so the other thing that it will do for the clinician, which is really key, we're talking about the patient, but for the clinician, it will the more the clinician can see, the more the clinician can actually treat. So it will give them an image of exactly where the condition that the person, the clinical demographic of the patient. So if they come in with a bad neck, a bad back, or they come in with an MSK trauma, it will show exactly the area. We're not diagnosing, we're pre-diagnosing. It will just show the area. And if you require further treatment on top of that, at least you'll know where to start. It's a starting point.
Yep.
Okay. And we have an AI portion that's built into that in a symmetry tool that in effect measures the thermal image and provides an imagery of hot dots all the way through the center of the inflammation. So it shows exactly where the problem is.
I love that. So I saw this. I came across, I know you've been traveling literally around the world talking about this device. I know there's a background actually in cardiology with one of your founders. So I say that with the context of this is real technology. And that was something where you and I met and you did a scan on me again, probably a year ago or so. It was a stark difference in terms, and I'd love for you just to maybe talk a little bit about the history and also how it works. What I'm leading in here is that the device was beautiful, it was small, it was easy to use. Like, so talk a little bit about maybe a little bit about the history and a little bit about how you've seen docs literally using this.
Yeah. Okay. History wise, the device goes back almost 4 years now from the original prototype. The company is USA Therm, but the holding company that started it out is Sofa Health, and Dr. Ari Sofa, who's a celebrity cardiologist, for want of a better phrase, comes from California. He's a vein doctor, a specialist in veins, and this device originally was for vascular insufficiency. That's what it was developed for, plain and simple. However, when you're doing thermography and when you're looking at veins, you're always going to see other demographics, clinical demographics. It's just a fact. And that's how it's extended out from where it is at the moment into diabetic foot, into a whole host of other things that we never thought we'd actually do. I must tell you now. And I also must say that at the very beginning, I'm being blunt, chiropractors were not on the radar at the very beginning of the launch of this product because it was for veins. I can tell you now that US chiropractors are the largest client of ours in the US, fact, as it stands now, because they have seen the opportunity to working with this device.
Mhm.
So why is that? Why are the why do US chiropractors want it? Okay, you have 70,000 thereabouts chiropractors in the US. The volume who've told me in many shows that I've attended over the last 2 years that one of their key problems is retention of patients. Uh, well, it is retention of patients. I think the average rate is around about 18 to 20% for chiropractors. How do they get that moved forward? Apart from the fact that they may well have a vibrant business, but how do they get it moved forward? They give it forward with having a unique selling proposition, the USP, a device that no one else has got. And this launches the market with that type of device. But you've got to get patient buy-in. And where your colleagues and where the chiropractors currently that have these devices, we have over 100 already in the last 6 months into chiropractor, both in various parts of the chiropractor arena. What they're looking to do is they're going to get patient buy-in at the very, very beginning. They walk through the door, they get scanned, whether it's their feet for neuropathy, whether it's their legs, whether it's their back, whether it's their neck. The patient gets scanned the moment they walk through the door. It blows the patient's mind, for want of an English colloquialism, because quite simply, they see the, and I've said it before, they see the pain. This is not a ultrasound. This is not an X-ray. We're not looking at bones. We're not looking at the gray area. We're looking at their pain. And the moment they see that, that patient will associate with it because they can act, that's right, that's the pain. You have the buy-in. And that is the way to start with building a profile of taking scans every time they come for the treatment plan, putting in place, depending on what's wrong with them. And then the patients come back and they want a photograph printed every time. They want to see their improvement by the way that the thermal imagery changes in color over the period of the treatment. It also shows you that the treatment plan you put in place works. That's really key. And it's not just that, other treatments that you as chiropractors will give may require, sometimes patients don't or may say, is it working? Or you can't tell if it's working instantly. If you took a photograph, a clinical photograph, thermal imaging before, like with shockwave treatment or any other time, and then afterwards, the patient can see it. It validates the treatment that you're giving, and that's what a lot of you chiropractors are currently, those that have the device are doing and doing very successfully. They're actually retaining the patients, and then the patients are referring the business on because no one else has got that device in the particular area.
Yeah, that's powerful. And one thing that really stood out to me was, especially for docs that asked this question, for the docs that might not be super familiar with thermography today, and they might think back to wired electrodes and utilizing, and that stuff can be really cumbersome in a clinical sense. So for the docs that haven't seen ThermPix or don't understand, does this take 45 minutes for me to do a scan? Does this take an hour and a half? Maybe highlight a little bit about how it works from a clinical usage sense. I see you holding it up. Perfect. Right on time, right there.
All right. So this is a Samsung tablet with obviously the gut stripped out and a whole new setup that in place inside with a thermal, a very strong clinical thermal camera. The photography from this takes seconds, literally seconds to take. Okay. So what will happen is you will take a thermal image. You will show the patient that image to get their buy-in. The moment you've taken the image goes straight to the cloud. It is read in the cloud and then sends back in a full format. So basically, the image goes to the cloud and comes straight back again. And then the patient can see their image against their own white light image, their own image themselves.
Yep.
Not only that, you can print a report from this. You have AI, what we call AI symmetry within the actual tool itself. So when you've taken the photograph, AI will cut in and it will read the image and it'll show you hotspots right through the worst areas, the most thermally challenged areas, for want of a better phrase. So if you've got a real mass on, say, for example, on your neck, it will have wherever the seriousness of the inflammation is at the worst point, it will have red dots running right through that. And there's also a histogram, a block chart that goes through that area, pulling together all of the pixels together into blocks over the most serious areas. You can also set a temperature. There is a spot temperature that you can take at the time of the area that you are taking in a photograph of. And all of that is on a report that you have printed down almost within a minute of it finally being completed. And you can print it in a PDF format, give it to your patients. And every time they come, if you take more photographs, you will just tag all of those photographs you've taken over the period of the time. And the report builds and builds and builds and shows them a thread of improvement, hopefully, on the treatment plan that you've been put in place. And it you've got them. They want it. They come back for it every time.
Yeah, the visual components I think are really world class and stand out to me. I'll ask a very basic question. As we mentioned, thermal scanning, is it, and this is going to be so basic, I'll sound a little silly asking it, but I'll ask it anyway. Is red bad? I guess in general, what is the
That's a
coloration?
really good question. Really good question, Jeff. And I sometimes get berated for the statement that I make. However, in the real world, green is good. Red, I'd say something else, but red is dead. Red is bad. But south of red, because bear in mind, there are two scales here. You have green in the middle. So if you had a perfect green thermal image, and no one is perfect, I haven't seen one yet, and I've done there's thousands. But if you have a perfect green image, you go north to red of inflammation and pain. You go south to dark blue, which in some instances, it would be looking at the potential of cold neuropathy. So you're looking at neuropathy where there is lack of circulation, where there is numbness, where a lot of chiropractors certainly are now, and that's where we started with this device 2 years ago, was looking at neuropathy and looking at the potential of photographing neuropathy and showing whatever in your restorative neuropathy programs, how that temperature change can be affected. The blue can change slightly towards a light blue, slightly towards a green, and then south of the red, going further down into orange, going into yellow. So your scale is green at the start, dark blue being lack of circulation, dark red being inflammation or infection. Okay, and what the plan is to go north or south with the treatment plan to get as close to green as possible. But it's very easy to read. Just so we're clear, this is what you're looking for. And the best analogy I can always give is think of a puzzle book and think of two pictures that are side by side, and you have to choose. When you were a kid, you'd have to choose the 10 differences between the images. That's what you're looking to do, because the symmetry tool will split the body in the area that you're scanning. And what you're looking for is the areas between the left and the right that are different. And that will give you actually showing you whether it's the left or the right, or in some instances where both sides of the body, they could be the same, but they are all yellow, or they're all red, or they're all dark blue. It's an aid memoir. And at this stage of the proceedings, it is a pre-diagnostic. Okay, but it gives you the indication and confirms to you what most times you already know, but you now know exactly where it is.
Yeah, the visual component again, I think is just so powerful. And I know a lot of docs were coming into December, and they're looking for how they are going to optimize and upgrade their practices coming into the new year. So I'll ask you straight up: when somebody's evaluating whether bringing ThermPix into their practice or not, what should they expect in 2026 as they add ThermPix in?
What should they expect in relation to further developments? Are you talking about?
Good question. I won't push you there. I'll say what can they expect in terms of the benefits it'll add to their practice, either clinically, conversationally, from a marketing sense. Maybe it's a little bit of all, but I'll let you lead the way.
Okay, let's start with a simple statement. Patients can see the invisible. Okay, they can see the pain. The key to ensuring that businesses are going to be successful always is the patient buy-in to the treatment plan that's being given. So there has to be a hook to make them go down that particular route. This is the hook that gives the doctors and the clinicians the opportunity to actually get the patient engaged at the very, very beginning. The moment they can see what's going on with the area that they come in with pain, and you're showing them the pain, you have that engagement. It's then down to the doctor to take that further forward and obviously do the treatment plan and such like. But for us, the enhancement of thermal imagery with patients has always, it is the patient's, it's key to the patient staying with the practice and also referring the practice on, which happens regularly now, referring practice on to their colleague, to their friends, saying, they've got this wonderful device here. It can actually show you exactly what's going on. And you get people coming and asking questions. I've had this back from chiropractors saying, once the door is open and they start getting the print offs, away they go. Yes, the device is a vessel for thermography, but we will be adding, it is also a vessel where there is an app store where we will add additional software as we go forward, which is being developed as we speak. Now, a taster for that, might as well give a taster now, is the fact that we already have an adjunct. We are for breast thermography. We're already, even though we're not advertising moving forward with that, under our FDA clearance, we're allowed to have the device as an adjunct for breast thermography in addition to Mammography. Okay. There is wellness programs that are already in the system, which will be turned on live as we go further forward in the future. There are other software additions that will be added based on different thermography of different areas. For example, we launch, which is what I've just been doing recently, we are launching into the diabetic foot arena in a very big way. And there is a software package that we are negotiating with at the moment, which will be added to the device. So this is only just as an add-on, just to let you know. But this is for anyone who's out there who sees lots and lots of diabetic patients coming through the door, because this will produce a report that it really does blow your mind. It's a 7-page report on everything to do with the particular disease that they're coming in with, which is the diabetic foot disease. So these are add-ons as we go forward. They will all be related to obviously the body. The device can scan anything from the plantar of the foot to the top of the head and all points in between. Okay. But exciting for us is the start of the diabetic foot, which some chiropractors have already asked us about, mainly because they're already dealing in neuropathy. And because of dealing in neuropathy, most of the patients, if it hasn't come from chemotherapy and in the hands, which of course this can monitor, it will be diabetics. And if they come in with serious diabetes, there is likely to be foot disease at some point. This will highlight that. It gives the clinician kudos if they then find that there is something else going on in addition to what they're looking at, which can then be referred on and potentially save a person's leg or save a person's foot.
Yeah. Lots of exciting updates coming down the pipeline. Wayne, this has been a fantastic interview. We're going to transition now to a presentation, a clinical presentation. So why don't you maybe just speak for a moment about what docs can expect as we transition to a really nice presentation.
Okay, well, we've got, I have a presentation here that has been, was launched in Parker Vegas, quite frankly, by one of our KOLs, Dr. Robert Kane, Professor Robert Kane, actually, out in California. And Professor Robert Kane has been around in chiropractic for over 30 years, but has been reading thermographic images for large corporations as well for almost as many years. So he has a on-the-ground slant on how this device can sit so well within your practice, how it will build into a business model moving forward, and how you can get the very best out of it. Okay, so that is the start of this particular presentation. Also, just did you want a summit only offer as well, Jeff, or do I give that to you?
Absolutely, absolutely.
All right. Well, if I can tell you this now, and if people write this down, okay, the code would be AI, no surprise there, and that would be 1225. If any clinician came back to us with that code, there is a general attendance offer, okay, which in effect, the price of the device would be $7,995, okay, and $195 a month on year 2 and 3 for the software. And on the VIP attendance offer, there is $7,495 and £175 a month from year 2 and 3. But just so everyone is aware, the normal retail price of the device is $8,995. Software as a service is £295 a month. So there's because it's specific to chiros, we're giving there's a really cool deal here for you.
I love it. That is a very, very nice discount. So docs listening and watching, please stay on the line and watch the clinical presentation, which is going to put this into action for you. Wayne, I really appreciate you coming on. And docs, if you are interested in thermography, ThermPix, I'm going to say, is not only a class-leading tool, they're giving you a fantastic opportunity to add that into your practice before year's end. So please check in all of the documentation on the summit where you'll get access to either the VIP discount or the general attendance discount. Wayne, thank you so much for chatting
That's
today.
all right. Can I, Jeff, just also give you that there is a specific US toll-free number, okay,
Please.
as well for them to call, okay, and that'll be 1-800-906-1225, okay? That will come through to me wherever I am in the world, and it's mostly around the world that I am, but I'll be able to then, obviously, and if they quote that code, then I'll be able to put together the deal accordingly.
Perfect. Thank you very much.
The future of chiropractic starts now with USA Therm's ThermPix, an FDA-cleared and clinically validated medical thermal imaging device. ThermPix is a window into real-time physiology. It combines the power of an 8-megapixel camera and a high-resolution thermal imaging sensor to produce full-color images of the patient, along with light images, side by side, so the patient can follow along what their thermal findings are with their actual anatomy. The images are stored on a HIPAA-compliant cloud, allowing for access on multiple devices. And the whole procedure is non-invasive and has no harmful radiation. ThermPix provides the following: real-time thermal mapping of the face, torso, and extremities, clear signs of inflammation, altered circulation, and neuropathy, visual evidence of the patient's concern in vivid color and detail, and a way to monitor changes of care independent of symptomatic status. Benefits of using the ThermPix device in your practice: number one, better diagnostics. Better diagnostics lead to better treatment outcomes. Better treatment outcomes leads to better patient understanding, better compliance, and ultimately better retention. With all of this, we're looking forward to increased referrals. The ThermPix device is convenient and versatile. It's light and portable, allowing for easy use in the exam or treatment room. There's no need for dedicated laboratory space or bulky equipment. Basic chiropractic applications are easy to learn, allowing you to be up and running with minimal training. AI-assisted analysis allows for fast, standardized assessment and less time analyzing images. And access to ongoing AI analysis innovations and application-specific trainings keep you at the cutting edge of this technology. Lastly, cloud-based storage allows for full database access independent of physical location. So how does this work? Well, thermal symmetry is an established biomarker of neurovascular function and homeostasis. Surface temperature is under the direct control of the sympathetic nervous system and its regulation of the superficial blood vessels. Research at Johns Hopkins University clearly established high levels of thermal symmetry in asymptomatic patients, along with normative data for side-to-side differences in specific body regions. A return to thermal symmetry signals improved homeostasis. So how does this work for chiropractors? Well, in the vertebral subluxation complex, we have 5 main components: kinesiolopathology, neuropathology, myopathology, histopathology, and pathophysiology. All 5 of these components have the potential of altering skin temperature, either at the spinal level, where the subluxation is occurring, or at the peripheral level in the end region where the nerve is serving. The heart of the chiropractic practice is the subluxation complex, so being able to visualize what that's doing on the neurovasculature is critically important. ThermPix is involved with different conditions. It can be helpful in the identification and monitoring of all of the above: spinal subluxations, acute and chronic pain syndromes, spinal and peripheral neuropathy, muscle and myofascial compromise, headaches, circulatory problems, and compromised athletic performance. In example 1, we see a few things. This arrow here points to some spinal warming, which is likely due to subluxation. All thermal findings need to be clinically correlated, but the ThermPix device shows you immediately an area that's irritated that requires your attention. A similar finding is noted here. Now, if we look at this arrow, it's pointing to something in the rotator cuff. If the patient's concerned, where is that on my body? You can just point to them right here, and using the light image or the standard photography image, you can cross-correlate and easily show them where the problem lies. In example 2, we've got a little bit of warming on the right rhomboid region. This particular patient actually had subluxated ribs. Interestingly enough, these subluxated ribs were actually causing part of her shoulder pain, which you can see right here is a warm rotator cuff. We also note some warming in the rhomboid region down lower, which was part of the complex. Now, her lower back was mildly symptomatic, but it did show up red, showing the chiropractor and the patient that we had an additional area that needed more evaluation. On this patient with hand problems, we noticed warming by the knuckles, both sides. Well, with a diagnosis of clinical arthritis, we were able to visualize the arthritis and show her the extent of the problem. Now, you may ask, why is this valuable if we knew the diagnosis? Well, if we're going to treat her and hopefully give her some relief from her arthritis by lowering overall inflammation in the body and affecting it locally, we want a baseline image so that we can do pre and posts and watch this warming go away. This is a patient with dysautonomia where the sympathetic nervous system is not working properly. You can notice here a lot of buildup of heat in the face and a specific hotspot over the right maxilla. We notice on the post image, this looks like it's gone away. Same thing with the pre and post images on the back of the neck. AI analysis will help in the following manner. Here we have a patient where the actual thermal findings are not as dramatic as we might like. They're not quite as obvious. To my trained eye, I could see a little warming here versus here by the lighter color. I can also see a little cooler here versus here, and I can see warming down in the lower back. This all corresponds to his back image. Notice we do have some thermal activity, this little lighter green area in the area of a mole. This is a signal to let this patient know to get that mole evaluated. Using our AI symmetry tool, we're now able to analyze the back, look at the symmetry, and graphically represent it. This is our histogram tool, and what it does is it measures line by line each area of the body going up the image and compares the right side of the image, the left side of the image to the right side of the images. It calculates which side is warmer and assigns a color and a bar to note the warmer area. Green means there's very little asymmetry and it's mostly a normal appearance. Yellow is a moderate amount of asymmetry and red is a high level. It might not be as obvious from this picture, but it's very obvious from here, the areas of asymmetry. This data here is then translated into a task score, a thermal asymmetry score, which gives us the overall value or the overall level of asymmetry in those particular regions. The task score is in 1 to 10, 1 being the most amount of symmetry and 10 being the most amount of asymmetry. Incorporating this into the thermal imaging practice, into the chiropractic practice is easy. We generally start off with history and inspection as we examine the patient on their first visit. We now incorporated the thermal symmetry check in that protocol. We then move on to any examinations or evaluations we might do, additional imaging, and design the treatment protocol. Once we have that, we give them the report of findings. It's very important during the report of findings to demonstrate the ThermPix findings, show them the images, and show them how it relates to their concern. We can then initiate a trial of care, and after a period of care, re-examine. During the re-examine, we can repeat the thermal symmetry test in order to determine the next stage of care. Using the thermal symmetry tool and ThermPix thermal symmetry approach, we can see the invisible and incorporate real-time physiological data into the chiropractor's approach to care. Harnessing the power of AI, we can improve outcomes, and we can engage the patient fully with graphic evidence of their condition, task scores, and histograms to really demonstrate the effects of your care. Improved outcomes and graphic patient education means better patient retention and more referrals. The question is, are you ready to be a ThermPix chiropractor?
If you want the best deals on products and services, along with some of the best speakers in chiropractic, you're going to want to register for our next summit coming up soon. Click on down below and register today.